Good morning, Minister, and thank you for joining us today. In international news, the FDA may move towards updating COVID 19 vaccines to target specific variants. With the current trend in the virus, how important is it for vaccines to be updated towards a changing virus?
So what you have right now is the variant that is circulating is predominantly from Omicron, but Omicron has a number of subvariants, BA1, BA2, BA3, BA4, and BA5. And of these five subvariants that are circulating, you have BA2, BA4, and BA5 that are now predominating. So one of the things that has happened with these different subvariants, the spike protein has changed. And this is the protein that was used for the immune system to detect these vaccines and to react to the vaccine. So if you have a change in the spike protein, then the immune system would not react as effectively. And therefore you have to change that protein to match what is now circulating. And that is why a lot of the manufacturers now are changing the spike protein to reflect the current circulating Omicron variants. So Pfizer has started, and Pfizer has now what is called a monovalent vaccine and a bivalent vaccine. Their preliminary clinical trials have gone very well, so they have seen people who got the vaccine that they've had a very good immune response. You have some other manufacturers that are now working on a similar type of vaccine, and hopefully we'll have more vaccines becoming available that can be used as booster specifically against the Omicron variant. So this is good because now we will have a vaccine that is very specific to the variant that is circulating. Predominantly the ones that we're using now is Pfizer. We also have Pfizer for the 11 to 5 age group, so that the dosage there is smaller. It's 1/3 of the adult dose. And we have, of course, Pfizer for adults. We also have limited quantities of J&J, and we have limited quantities of Sinopharm. So these are the three vaccines that are currently in use in Guyana. Vaccination numbers in terms of boosters, we are now at 68,430 doses being administered. So we still need to do a lot more in terms of getting people to take the booster doses. In terms of the 5 to 11 age group, we are now for first dose 3,202 doses given, and very soon we'll start working on the second dose. In terms of the 12 to 17 age group, we are now at 34,986 first doses and 25,598 second doses. That's 48% of that age cohort and 35.1% respectively. And in terms of adults with their primary doses, first and second dose, first dose we've given 443,622 doses. That's now 86.25% of that population, 18 years and older. And in terms of second dose, we have administered 343,407 doses, or 66.9% of the adult population.
You have been watching the COVID-19 update for today, June 28, 2022. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. I am Shania Gonzalez.